Hi everybody, my name is Dr. Mike Blaney. I'm a general and bariatric surgeon in Augusta, Georgia. Live Healthy MD, our practice. We are a comprehensive surgical and medical weight loss center. And what we're going to talk about today is the hormones that regulate our weight. We've learned a lot over the last decade or so about metabolism and what controls our weight. And we really believe that obesity is a disease of hormones. Hormones really control everything within our body, by and large. And we're familiar with some of the hormones that play a role in diabetes, like insulin, or play roles in thyroid disease, thyroid hormone. Unfortunately, with obesity, there's many different hormones that seem to have a role in our metabolism. Some of these we're familiar with already: growth hormone, thyroid hormone, the sex hormones, testosterone and estrogen play a role. But there's other hormones that you may have not heard of. One of these that we talk about is ghrelin. Ghrelin, we believe, is a hormone that's made by the cells in the stomach. And we think that this hormone controls our appetite and our desire to eat. We believe this is one reason the sleeve gastrectomy is effective in leading to weight loss. The sleeve gastrectomy involves removing a significant amount of the stomach. So by removing a large part of the stomach, you're removing, theoretically, a large percentage of the cells that are making this hormone known as ghrelin, so people are much less hungry. Additionally, there's other hormones that we think play a role in our metabolism that you've probably not heard of. One of these is called leptin. We think leptin is a hormone made by our fat cells and seems to have some role in the breakdown of fat in our body. Kind of change in thinking about fat. In medical school, I just kind of thought fat was just part of our body that was just there, and it really wasn't an organ. But really, we're starting to believe that the adipose tissue in our body is an endocrine organ, very similar to the pancreas or the thyroid or the adrenal gland or the pituitary gland. An organ that's making hormones, that's regulating our metabolism. Now, fat is very different. We think of fat, adipose tissue on our body, two general types. We have what I would call external fat, the adipose tissue on the outside of our body, call that peripheral fat, or adipose tissue on the inside of our body, that's called visceral fat. And we really believe that the visceral fat is really more of an endocrine type organ, and it's making these hormones that regulate our metabolism and tend to result in some of the medical problems that we see in our obese patients. It's rather interesting that some of our larger patients, who maybe are 500-600 pounds, have a significant amount of external fat on the outside of our body, but are actually very thin on the inside of their body. They have very little visceral fat. And as a result, they tend to not suffer from some of those medical problems like diabetes and hypertension, whereas other patients may be rather thin on the outside of their body, tend to have thinner arms and legs, and tend to carry most of their weight on the inside of their abdomen. So they have a much larger amount of visceral fat. And those individuals most commonly suffer from those weight-related comorbidities that we treat with weight loss surgery, like diabetes and hypertension. One of the other questions that patients have asked is, how can I control these levels of hormones? Unfortunately, this is a genetic issue. Some individuals have more ghrelin or less ghrelin, I believe, and I think that probably explains why some people are more hungry or less hungry. So unfortunately, this is not something that you're going to be able to control. The exciting thing about weight loss surgery is that we believe these operations change these hormones in positive ways that lead to weight loss that you cannot do on your own through voluntary efforts of dieting and exercise. And I think, that may also explain why dieting is so difficult. And when I look at different individuals across the weight spectrum, particularly after weight loss surgery, we'll see that some individuals lose significantly more weight than somebody else, even though they are seemingly, at least as best as we can tell, behaving in very similar ways in terms of their eating behaviors and their activity that they're doing. So I hope this was helpful. Thanks for watching. If you like this video, be sure to give us a thumbs up and subscribe to our YouTube channel for other more and exciting videos surrounding weight loss surgery.